when lives are on the line.
Are there any obvious injuries?
These men and women will risk theirs
The lad who was driving got blood coming out of his face.
to save yours.
RTC truck.
They deal with the most serious injuries.
The patient is described as bleeding heavily.
Directly below his ear.
There's a lot of blood there.
The most critical illnesses.
The reports of a male who's in cardiac arrest, and without any action, the patient will die.
The two Yorkshire Air Ambulances cover Britain's biggest county.
He's fallen 30 foot from the roof.
Oh yeah.
He's got a big cut to his head.
5 million people rely on them
All right, sorry, sweetheart.
to deliver cutting-edge emergency medicine
We're just going to go to sleep. He's not looking particularly good.
at high speed.
If you can activate your major hemorrhage protocol.
Every day brings high drama.
2 of them are pillion traumatic cardiac arrest.
This lady needs some blood.
Get this guy on a scoop, get him on that trolley, pop him off to sleep.
High stakes.
You like swerve, you just hit her.
Few steps, and we're going to just lay down on this stretcher. Was this up here? That's broken as well.
And high risks.
Yeah, he's just got tight in the chest.
Unfortunately, Paul's got a history of previous heart attacks.
But today was like, definitely, he was like, you know that.
Yeah.
It's a clear autumn day in North Yorkshire, the kind that brings motorcyclists flocking to its winding country roads. But the fast rural routes around Ripon are notorious for accidents.
To the north. Clear left. It's Ripon, isn't it? Yeah, Ripon, yeah.
Paramedics Lisa and Sam are heading to a serious crash with Dr. Chris.
The reports of a motorcyclist and passenger who've come off. It appears that one of them isn't breathing, so at the minute they've started CPR, so they started doing chest compressions and helping with the breathing. So things don't get any worse than that. So it sounds like this is a traumatic cardiac arrest, which unfortunately, even with everything we can do, it carries an awful outcome.
Helimed 98 will cover the 37 miles in just 15 minutes. But their patients have potentially catastrophic injuries. Every second counts.
So the one that's in traumatic cardiac arrest will do a thoracostomy apiece.
Is it a traumatic arrest of the heart?
Yeah, it sounds like it.
Okay.
So there's just up to the right, just up there, between the light cemetery.
There, it's literally on the back corner, isn't it? You see it, at least.
Put it on your side anyway.
Oh, you see the truck, the slow traffic, yeah.
You see the ambulance. It's just kind of 1 o'clock low.
To save precious time, pilot Jeff is bringing the helicopter down as close to their patients as he can.
Yeah, you're good left, mate.
How's about that?
Yeah, we're banging between the trees, mate, so if you can come left a bit. You happy with that tree at your 11? Yeah.
They're joining ground paramedics fighting to save 2 lives.
They're out.
Yep.
At 60 miles per hour, a rider and his wife came off their motorbike and were hurled into a hedge. Witnesses say the biker swerved to avoid a pheasant in the road.
Hiya, you all right?
2 of them are pillion, come off the bike, bystanders coming along beside him.
Right.
Using traumatic cardiac arrest when bystanders found him. So
Okay.
they initiated CPR straight away.
Right.
Both patients are fighting for their lives. They both have critical injuries.
That's where we're up to at this moment in time. That one is conscious, breathing, not a chance for a sec, but I've got a CS with that too.
Right, okay.
Yeah, so no concerns with her
Right.
at this moment in
Okay.
time.
You happy?
No numbers or anything.
So you guys looking after this chap? Yeah. You happy if I have a look and then we'll start getting him across?
57-year-old Tony Murray is close to death. Paramedics restarted his heart, but both his lungs have collapsed.
He's not got great chest rise at that. Okay.
His CO2's fine.
Yeah, okay. Fine. He has got a very faint radial. So what we need to do is we need to give him an anaesthetic, get this guy on a scoop, get him on that trolley and pop him off to sleep.
Tony could die at any moment. Little oxygen is reaching his brain. To keep him alive, Dr. Chris must anaesthetise him by the road and take over his breathing, a procedure called an RSI.
You have a look at her and I'll get this one set.
Sam is treating Tony's wife, but her condition is deteriorating.
This RSI, is that one poorly? Yeah. Yes.
So this one, I don't know the deal with this one, but this lady has got reduced DCS, absent radial pulses, very powerful central pulses, complaining about low pain. So I think she probably needs some blood.
49-year-old Linda's blood pressure has nosedived. She is bleeding internally and is in danger of cardiac arrest.
She's in a position more or less to move. We can roll her onto a scoop, get these vehicles out of the way, and we can just go to Leeds.
Agree with that. Can we get another doc here or not? Should we just ring the air desk? She needs to get going, but we can do it on the way, potentially. Do you want to ask the air desk and we'll sort this one out?
Air desk is Great North available.
The team are calling in a neighbouring air ambulance for support. Both patients' lives are hanging in the balance. Both must be anaesthetised by a doctor, and there's only one on scene.
He has got a radial and he's got a good SATS trace on there. The difficulty I've got is that lady needs an RSI as well. We'll RSI this guy first. Yep. But I need you guys to get him on that trolley. Are you happy to set up a kit dump? I'll get some drugs.
Tony has been biking since he was a teenager, and with Linda for the last 5 years. Now, a split-second reaction has left them both fighting for life.
Right, should we do a GP on a just blood pressure thing?
Dr. Chris must decide who to treat first.
Can I steal your suction for a minute?
Tony is the most critical.
So you're happy with air? B, we're breathing for him. Any respiratory effort? No. Right, OK. Are you ready to get him across? Have we got a scoop on that ready?
Lisa and Sam, what we're going to do is that fella on that trolley for 6'3", this girl on here for us, and we'll RSI here, OK?
OK. Right, are we ready to get this guy on a scoop?
While Lisa preps Tony, Sam is desperately trying to stabilise Linda.
My plan, before we start doing anything else, I'm going to set this fluid up to run through, give her a bit of that. I'm going to give her kind of probably up to 30 of ketamine, nice and steady, just to see how she does with that.
I won't give her too much, I'll give her a very small amount.
And then kind of, and then I'll...
And we'll plan to go with her.
And then plan to kind of run with her.
Steady, lift.
Good. Right, everybody's feet clear.
We've got nothing tied up.
Everything's clear. Right, walk down the stretcher.
They're turning a trolley into a roadside operating table.
Down.
Down.
Lisa, she's looking a bit brighter, so why don't we RSI this guy here now? Yeah, I've got a kit done set up, I'll bring everything across.
Does she need RSI in?
No, she looks a bit brighter now.
Right.
She's clinically bleeding, but her GCS is a lot better than it was.
Right.
Okay.
There's no time to lose. Dr. Chris must anaesthetise Tony immediately.
She's kind of doing exactly what you're doing. She's doing a grand job.
Who's giving drugs?
I'll give the drugs.
Are you happy with your doses? Do you want to confirm them?
Yeah, we'll do the checklist out loud.
Right. Drug administrators. Yeah.
Me.
Team brief.
So what we're going to do is need this guy an anaesthetic. It's alive. It is a high-risk procedure, so we just need to keep nice and quiet whilst we do it. Plan A is going to be to tube him. Plan B will be the eye gel. Plan C will be face mac, and Plan D is to make a hole in the front of his neck. Is everyone happy with that?
Okay.
Okay. Everyone ready to start? Any concerns, comments, questions? Okay.
Tony's survival could depend on the success of this procedure.
You good to go, Lise?
Yeah, when ready, whenever you are.
Dr. Chris must suspend Tony's assisted breathing while he inserts a tube into his airway.
We'll just be aware that he's probably going to, as we're going to do this, that aircraft's going to be landing, so it's going to get a bit noisy and a bit blowy potentially. Can I take over? Is that okay?
Yeah, sure.
Thank you. Okay, just everyone hands off the patient just for a minute if we can.
We've got second access in the hand.
The ringer please.
Yeah,
right in my hand.
It's a difficult procedure, normally carried out in a sterile hospital environment.
Bougie.
Dr. Chris is guiding a tube directly into the lungs of his patient.
Tube's going down. 23, bougie out.
At last, the tube is in, and the team can take over Tony's breathing.
We'll take that back to 22, so let's secure that. So I'm happy with the tube's in position. Lise, we'll do this. Do you want to get ready for your thoracostomies?
Yeah.
Just in time, the second air ambulance has arrived. The race to get Tony to hospital is beginning. And just yards away, the medics are still battling to save the life of his wife. At the roadside in North Yorkshire, a second air ambulance doctor is about to join the fight to save bikers Tony and Linda Murray. Their lives are hanging in the balance after Tony apparently swerved to miss a pheasant.
You happy just to bag?
I'm just going to release him up here.
57-year-old rider Tony has been anaesthetised at the roadside by Dr. Chris, and the team have taken over his breathing.
So his CO2 is 4 to 4.5, is that all right? Perfect. She did a grand job there. Okay. Lisa, do you want to pass me a set as well?
Tony's ribs are shattered and both lungs have collapsed. The medics must puncture the chest wall
Right, I'm through.
to allow his lungs to re-inflate.
Okay, I'm through. Lungs up. Okay. We've got two cannulas. Is that? If you want to just secure that, is that all right? Hello.
The Great North Air Ambulance has been called in to assist. Their team will take over Tony's care, so Dr. Chris can concentrate on Linda.
This guy's been on that motorcycle, the two of them, come down here, lost control, ended up in there. On the arrival of us, his airway was an eye-gel, breathing, no spontaneous effort. He's had an RSI that was at, I get that, so 14.28. He's got some fluid up just to push the drugs in, and I think he needs to get going.
Dr. Chris has done all he can for Tony at the roadside.
All right, thanks, guys.
He must now switch efforts to his wife.
Are you happy just to hold that face mask over her whilst I draw up some more drugs?
49-year-old Linda is in great distress. She is critically injured and bleeding internally.
So plan is going to be, we're going to have it nice and quiet, going to intubate this lady with some anaesthetic drugs. Plan A is to put a tube into her throat, plan B is an eye gel, plan C is face mask, plan D is front of neck access. Okay, everyone happy? Happy to start?
Dr. Chris is going to anaesthetise Linda, just as he did her husband.
Has anyone got any flush knocking about?
Linda's life depends on a precise combination of drugs being administered.
Give it a flush and then get the blood started again.
The team wait for the anaesthetic drugs to take effect.
Okay, lovely, thank you.
Linda is now paralysed.
Scope, please.
Dr. Chris must work quickly. Linda could go into cardiac arrest at any moment.
So I can see the epiglottis. I've got a grade 1 view. Bougie, thank you. Tube on, please.
A tube is being passed directly into Linda's lungs.
Tube's going down. Okay, bougie out.
From now on, a bag will be used to pump oxygen into her lungs.
Okay, just going to gently bag. Chest is rising. I'm quite happy at that. Okay, fine.
Linda is now unconscious, but she is still bleeding internally. It doesn't look good. The Great North Air Ambulance is taking Tony to the James Cook Hospital in Middlesbrough, where a full trauma team will continue the efforts to save his life.
Air Desk Medic 2. Patient 2 RSI'd about 5 minutes ago.
Air Desk Medic 2, second patient, RSI'd.
Okay, ready, steady, lift. A little bit nice and high. This lady's really sick. I think she's bleeding to death from something that's going on in her tummy. So, she's nearly in cardiac arrest. We need to get going.
Radio's leads and lifting.
It will be a tense 10-minute flight to get Linda to the Leeds General Infirmary.
You are clear left and above there.
So husband's gone, or partner, whoever he is, has gone to James Cook.
Yeah, I know they're split up, but...
Well, it's going to be tough piling two in with so poorly to one hospital.
Agreed.
And it meant the logistics of getting both on roof of LGI.
It's one of the most challenging jobs I've done. You've got, two patients, both critically unwell. One who's been in cardiac arrest. This lady who, she looks really, really sick, and I think this lady's bleeding into her tummy or pelvis torrentially. So we've got some blood up. Blood pressure's still very low, and we need to get to hospital and get the surgeons to help control this bleeding. You happy? Can you give another 3 mils of the ketamine for me, Lisa? Is that okay?
Yeah. 3 mils, yeah.
Yeah.
Air Desk 98 on approach, LGI.
Everybody locked and tight.
Yeah, got it back.
Yeah.
That CO2's tailing off again, isn't it?
It is,
Yeah.
Linda is deteriorating fast.
Air Desk 98 London.
Ready, steady, move.
The hospital trauma team will take over now.
Okay, listen up, please.
Okay, so this is Linda, who was a pillion passenger on a motorcycle up near Thirst. On a very straight bit of road, they've come off, crashing at estimated 60+ miles an hour into a hedge. The other patient who's in traumatic arrest has a rostrum from elsewhere up to James Cook. She's got a head injury, she's got abdominal and right side with a large abrasion down that side.
Linda's injuries may not be survivable.
She had an RSI at 1446.
Over the next few hours, the medics here will do all they can to save her life.
Ambulance, is a patient breathing? Tell me exactly what's happened.
High over South Yorkshire, flying at 150 miles an hour, the air ambulance is racing to a head-on crash.
You may well be first on scene. Your resource behind you is 14 minutes away. Fire are on scene. There's 3 patients trapped up.
Roger, received. 3 patients trapped. ETA 4 minutes for us, over.
Is it the A57?
Details are sketchy. On board are Dr. Sarah and paramedic Al. Up front, Daz and pilot Jeff are trying to spot the location from 1,000 feet up.
Right here, is it? See the
yeah. 9-9 with visual sleep. How many DCAs you got running towards the time?
And you've got a rack and 2 DCAs have been allocated.
There's a piece of metal linked to the engine.
A hole in the hedge.
9-9, we landed.
The cars collided at high speed. The impact catapulted one engine into a roadside field.
We were behind this silver one. This car, the Jag, coming this way.
Yeah.
You like come that corner.
Yeah.
Lost control, swerved, and come back across and just hit it.
Who lost control? This one or that one? Oh, the Jag lost control.
Yeah.
Okay.
Pull the car burst into flames.
Wreckage is strewn across a large area. Firefighters are struggling to free the occupants of both cars.
So what we're going to do?
So I think the priority one here, we'll probably take this guy in.
Okay.
So I can nip and get some extrication tips for this guy in a minute if he's going to come straight out to a scoop.
Yeah. Is he still breathing?
In the wrecked Jaguar, the driver is trapped with a suspected spinal injury and he's bleeding heavily.
Pull him out the side if we can do.
Do you want him out quick?
Yeah, he needs to be quick. He's awful, Colin. He's just had a little fit. How quickly can you do it?
Quickly.
There's no time to lose.
Is he breathing? Just pull him out then. Just pull him out.
The driver of the Jaguar would usually be carefully cut free. But Dr. Sarah is concerned for his life. She'll risk the chance of causing further injury.
Shall we just get her out and lie her down on a scoop and then we're going to have a bit more access to this other chap?
40 yards up the road, paramedic Al needs to examine the 2 people in the other car.
OK, do you think you'll be able to stand up for me? Will we give you a hand? OK, so what we're going to do is just stand her up, lie her straight back down on that board again, OK? Swing this leg and anything changes.
It's thought that the cars could have collided at a combined speed of over 100 miles an hour. Passenger Ruth Taylor is dazed and in pain.
OK, sweetheart, a few steps and we're going to just lie you down on this stretcher. OK. Right, just turn. Turn with me. We get under her other arm. Right, we're going to we've got you now. Just lie down. We've got you. OK? Just lie down, lie down. There we go. Perfect. OK. So there's a strap in the middle there. Let's get that on. Have we got some more straps? OK.
Fire crews are working hard to cut Ruth's husband free. 49-year-old Dave has multiple injuries and broken limbs.
He's only just a little bit trapped by his foot. He's got some pain in his thigh. If I get some access, we'll give him a little ketamine and we could probably just get him out. Was this up here? Oh, that's broken as well. He's got a fractured humerus this side as well.
While the team works on Dave, Ruth is on her way to hospital.
David, it might hurt a bit this. Can I bring that arm across? There, like that. And just put it on your lap. Oh, yeah, tough. All right, and we'll get a triangular bandage. She's in a bit of pain, but she managed to get out of the car by herself, so that's probably a good sign.
The medics have managed to stabilise the driver of the Jaguar, for now.
2, 3, lift, and we can slide him on here now.
By air, it'll be just 5 minutes to Sheffield Northern General Hospital, where a full trauma team is waiting.
You're just getting some painkillers now, mate.
In the wreck of the Toyota, Dave's condition is deteriorating. The race is on to extricate him from his car.
The obvious injuries are both his arms are broken. I'm more concerned about his chest because he's got quite rapid, shallow breathing and pain across his chest, which is probably indicative of a chest injury, you know, which could be potentially life-threatening. We've not been able to get any IV access on him, so we're having to give him some ketamine up his nose in order to kind of make him a bit more comfortable as we extricate him, which is going to be quite a painful process for him. How are we doing, Dave? Has that medicine started working at all?
I'm not sure.
Not sure. Shall we give you a little bit more then? Okay. So 1, 2, 3, nice deep breath. That's it.
The team will now attempt to lift Dave clear of the wreckage.
Where's it hurting, Dave? Right leg, yeah. Top of your leg or the bottom of your leg?
Middle of my thigh.
Middle of your thigh, yeah, okay.
The impact of the crash has shattered Dave's thigh bone.
So it looks like he's got a fractured femur.
There's a risk the jagged bones will cause internal bleeding. They're going to apply traction at the roadside.
I'm going to straighten your leg, it's going to hurt rather a lot. So grit your teeth, keep talking to this handsome fireman. So what you're going to do is I want you to get hold of his ankle either side. Pull nice and hard. That's it, now I want you to lean back and keep that traction on. Okay.
Dave's leg is splintered to keep it immobile.
Okay, there we go. Okay, you should be able to let go now. Right, Dave. This young lady's done a great job in getting a needle into your vein, so we're going to give you a bit more of that strong painkiller, all right? How's the pain now?
7 or 8.
Okay, is your leg a bit better since we put that splint on? Yeah, it's broke, is that leg? All right.
Al is keeping his patient talking, but he knows Dave has life-threatening injuries.
Right, Dave, we're going to bob you in the ambulance, take you to the Northern General, yeah, I guess.
Al won't wait for the air ambulance to return. It's 20 minutes by road, but it'll be a bumpy ride.
Probably give him some TXA now and a bit more pain relief on the way. How's that pain now, David?
About a 6 or 7.
A cocktail of strong drugs is only just controlling Dave's pain. He's arriving at hospital in Sheffield, where doctors will take over his care. He faces hours in surgery. His injuries could be life-changing. Getting thousands of people off their couches and into sport is helping save lives. Fitness is key to beating premature death, especially from heart disease.
Heads about to fly. Unguarded. Confirm that. Bells and harnesses.
But in rare cases, taking exercise can bring on a heart attack.
Close and secure front right. Close and secure in the back. Close and secure front left. Fairly brief. I'm going to go this way, along the taxiway, and then continue if you're happy with that. Ecstatic. They are all clear left, clear rights.
Helimed 99 is taking off from RAF Topcliffe on an emergency mission to a cyclist in Woodland near Scarborough.
Sorry, non-standard departure.
Paramedics Pete and James know it's an urgent case.
We've been dispatched by the air desk to a male who's got chest pain in Dolby Forest, which is a large forest in the area of East Yorkshire that's quite difficult to get into by land. When we think about the length of time that it's going to take to get this patient to hospital, all the time that blood clot's in place, if the patient is having a heart attack, the heart muscle's dying. So the quicker we can get him to a centre that can get rid of that clot, the less damage will be done to the patient's heart muscle, and the better their outcome.
Is it at the visitor centre?
Well, she says it's at the cycle centre. I don't know if that's the same as the visitor.
Same place. Nice cafe. Just saying.
Hashtag just saying.
Pete's a keen cyclist himself. The forest is a mecca for mountain bikers.
Any idea where that is? Yeah, the cycle centre is that courtyard with the cafe. It's in there.
What's down the bottom here?
Yeah.
Happy to go on that square there on the left-hand side of the T-junction.
Pilot Colin knows how much damage the helicopter's downdraft can cause.
Got solar panels on it, isn't it, I think?
Not for much longer, Colin.
Auto trim, please.
Auto trim.
Right, you are clear to the left, Colin. Thank you.
He's landing on a grass verge yards from their patient.
Christ, well, we're in limits.
Are we? You happy?
Just double check. Yep, 9 degrees.
Okay, 99, landing soon.
The cyclist's in the care of local paramedics.
Okay, this is Paul, is 52-year-old.
Hi, Paul.
Previous heart attack 2 years ago.
The average age for a first heart attack in the UK is 65. Ex-soldier Paul Truman was just 57.
He developed some sudden pain in his chest, radiated up into his neck.
Okay. Now let's have a little look at those.
Paul's ECG trace should show signs if he's having another heart attack.
100% were SATs.
Smashing.
Got a good pulse at 100.
Good.
His friend Craig was cycling with him.
Unfortunately, Paul's got a history of previous heart attacks. Paul's just gone to use the local toilets here. What happens is he come back out of the toilets and almost looked to be sort of suffering. Kind of looked a bit drunk, and that's the point when I kind of realised that there's a bit of an issue here. So we kind of immediately got down, asked the guys here, which very quickly got in touch with the ambulance.
So you were cycling for a couple of hours, is that right? And then you started having this pain, is that right?
Yeah, it's just got tight in my chest.
Yeah.
Just this side.
Yeah.
Okay.
And then down my arm.
Okay.
Then it started to radiate up my neck.
Yeah.
And then a little while ago it started to radiate down the...
Okay, no worries.
His medical history is complicated. The blocked artery in his heart was opened up 2 years ago, and a stent inserted to keep it open. But there was a problem.
And then when I had the stent put in, the stent got blocked. So I had to go back down to surgery again.
His attack is unusual and very worrying for him.
Right, Paul, would you just sit on that seat there?
Pete's checking his heart rhythm. And at first glance, there's nothing unusual.
There's nothing there triggering PPCI at the moment, so at the moment it's looking for Scarborough.
Yeah.
Have we actually got a signal here? Where did you have your stents put in, Paul?
Castle Hill.
At Castle Hill?
Pete's off to call the cardiac unit that first treated him.
Hi, sorry to bother you. You've got a landline I could use, please.
The heart traces of all cardiac patients are kept on their NHS records. And doctors at Castle Hill Hospital in Hull are being asked to check Paul's current readout against his old one.
This is just clear water, yeah?
Yeah.
You've had all this done before, haven't you?
Yeah, I've done it.
You'll be able to tell us after.
I used to be a paramedic.
Oh, did you?
You're joking. Did you?
Where did you work?
Out in Leeds.
Special forces.
Oh, were you? Right.
Pete's gone to ring me over Castle Hill and just see, because hopefully they'll have a copy of his old ECG.
Despite Paul's symptoms, it doesn't look like a major heart attack.
So we'll just hang on for Pete. I mean, as I say, it all looks good at the moment. We'll do another one in a minute and just see if there's been any change.
When someone's had a heart attack or having a heart attack, we do what's called an ECG, which looks at the electrical current that's running through the heart muscle. If there's damage on the heart muscle, that ECG will look different and we'll see what we call elevation or depression. If someone's had a heart attack in the past, that can also leave telltale signs on the ECG, but you can't discount that until you know what's going on.
The team are coming to the conclusion he doesn't need a flight to a cardiac centre.
There's nothing to do.
No, I don't think so. I think now he's nice and still.
Yeah,
you can see there.
Once we've got him relaxed where he was sat, we just got sat forward and hunched in it.
Yeah.
Paul's had a heart attack in the past, and we know that he's had treatment at Castle Hill Hospital at Hull. So, spoken to Hull and discussed the ECG with them, and everything that they've described on there, basically, there's nothing that's changed, which will be what we will be looking at. So, in this case, it doesn't seem. He's certainly not having an acute heart attack. He doesn't need to go for a PPCI. So the crew are going to take him to the nearest general hospital, which is York, by land, which is probably quicker than us flying him, to be honest, from here.
It's a big relief for Paul, who was impressed with the speedy response to the 999 call.
Are you busy?
This afternoon we've been a bit busier. Yeah, so we just landed and got some more fuel, and then we were sent to you. So my dinner's in the microwave as we speak.
Mine's still in the car.
Is it?
Paul's off for tests.
Cool. No worries. No.
Thank you.
Nice to meet you. See you soon, Paul. All the best. Bye.
It's hoped his chest pain was just a false alarm. But time will tell. Back at Air Ambulance headquarters, there's been some bad news about two of the team's patients. Bikers Linda and Tony Murray were left fighting for their lives after an accident near Ripon. Their two sons, Ryan and James, were quickly alerted by police.
I got blue lighted to the hospital in Middlesbrough, so we knew nothing about my mum to begin with, but we met up with my dad there.
Dad was in the hospital for 6 days before he eventually died. We had to make the decision to turn off his life support because he never woke up from his coma, and it was unlikely he would regain any brain function. Mum, however, spent another month in Leeds Hospital before she was transferred up to Newcastle.
My dad didn't have any visible physical injuries, whereas my mum, she was fully swollen up. She had bandages all around her head, tubes going up her nose and her mouth and all sorts. It was not what we were expecting at all.
Linda died in hospital from complications 2 months after the crash.
I really thought that mum was going to get better. The doctors were saying she was showing such signs of progress and coming along really well, and it was just completely out of the blue. Wasn't expecting it at all.
Tony had been biking since he was a teenager. Linda had joined him in recent years. The couple even toured Europe on 2 wheels together.
They absolutely loved life. They loved to travel with each other. They were on holiday all the time. My dad was quite a character as well.
Yeah.
He would never fail to make you laugh or come out with something which was
just odd but hilarious. But it was insane just how many people came to the funerals and just how many people actually cared about them that you don't realise and are invested in their lives and have been affected by the loss. I can not thank everybody involved enough for everything that they've done for our family.
It would have been awful if we'd never heard a voice again before the accident. It was, if she hadn't gone to the separate hospital, she would have never woke up and we would have never been able to say goodbyes.
Thanks very much. Got a job here.
Helimed 99 is being called to Derbyshire to assist in the rescue of an elderly man.
It's a 70-year-old been crushed by an HGV. They haven't got a doctor on their helicopter.
Right, I put Glossop on the GPS.
They're heading for the market town of Glossop, high in the Peak District. Paramedic Pete assists pilot Steve with pre-takeoff checks.
iPad is set for the grid.
Radios and lights.
Radios and lights are all good.
Dr. Neil and paramedic Lisa are on board.
So that the Helimed 75's going to it as well, is it?
Is that the one out of Blackpool?
Well, it's one of the Northwest.
Yeah.
No, 08 is Blackpool, so 75 is Manchester Barton.
The North Air Ambulance is already on scene, but they're not carrying a doctor. The case is serious, and they need Dr. Neil fast.
Multiple injuries have been reported, so he's got a significant foot or ankle injury and other injuries that have yet to be ascertained. It's relatively unusual, but we are always happy and willing to provide mutual aid to our neighbouring ambulance services.
Helimed 99 will travel the 26 miles in 10 minutes.
6 miles to run from the east-northeast. We're currently at 2,000 feet, 9 and 9 at 8 hectopascals.
The Peak District is picturesque under a blanket of snow, but plummeting temperatures could spell danger for their patient.
There they are.
I've got the DCA.
1 o'clock now, guys.
NS99, we're over at sea.
They can see the location, but there's no landing spot nearby.
We've got quite a walk.
Oh God, it's a right walk, isn't it?
Yeah. We're trying to flag someone down for a lift.
There's nothing any closer, is there? I'm just going to park here, then they can actually move around the back of us if they decide to go off of us.
Pilot Steve touches down safely on the local cricket pitch.
Alright, that'll do there, guys.
Happy?
Yeah, you clear out to 3 o'clock.
What do you want me to bring, guys? Load.
Hiya.
Lisa has bagged a lift from a helpful ambulance volunteer.
Do you want to see if you can get corporals in his boot?
Yeah, right. You'll squeeze some, I'm an EMAS responder.
Oh, right. You're getting in front. Oh.
Sorry, I'm sure you don't want to be listening to my rubbish.
This community responders seen us coming in very kindly, stuck his blue lights on his roof and he's taking us to scene because it's a little bit of a distance, so saves our breath for when we get to scene. You were definitely in the right place at the right time. Thanks very much.
Lisa and Dr. Neil are quickly briefed by the medics on scene.
We've got a 70-year-old gentleman. Yeah. We got it as an HGV. It's not an HGV.
Okay.
A car has driven into it. Contact with him around the knee.
Right.
It is an isolated ankle injury. Bone is out.
Right.
The reason we just kept running, the plan was we were going to have an attempt to reduce it. Cause
right.
It's looking quite dusky. Very, very weak pedal pulse.
What's he like pain-wise? Is he all right?
He's actually
happy with what he's got?
Bad, yeah,
right.
He's quite comfortable actually.
All right, we'll go have a look at him. What's his name? Harry.
The patient has been moved into the warm ambulance. His wife and daughters are understandably distressed.
We'll go and have a look at him and we'll come and see and tell you what's going on.
Little old man drove him just straight into
There's
the gentleman down there who's hanging at him.
2 seconds.
Move.
Hang on. Did he only hit his leg with the car?
Yeah, he just drove into his leg.
Yeah, you said he didn't hit his head or anything.
Did he bump his head or anything?
No.
Okay, right.
No,
Thank you.
it's just his leg.
We'll come out and tell you what's going on.
Yeah.
It's all right.
77-year-old retired engineer Harry Bates has a severe injury. The car slammed into his lower legs. The broken bones have pierced the skin in several places.
Spine tenderness, no back pain, no pelvic pain, no hip pain.
Feel me doing that, Harry? That's not changed.
You've not had any paracetamol in the last 4 hours, have you?
Lisa is checking for a pulse. If blood isn't reaching his foot, he could lose it.
Harry, can you feel me touching your foot still? Yeah. Where am I touching now? Underneath. All right. No pins and needles? Any pins and needles in this foot?
No.
So it's fairly warm, isn't it? So we can try straighten it and give him some Cormoxiclav, can't we?
Fractured bones can move and sever blood vessels. The medics will straighten Harry's leg in the ambulance, but it'll be painful.
Shall we have a go at trying to straighten it and get this vacuum splint round while those guys have that?
I keep breathing the Entonox.
How are you doing, Harry? A lot of people talking about you, isn't there?
Harry's in a lot of pain. He has a chronic lung condition which makes bones more brittle, and he takes blood-thinning drugs. Both his legs are broken.
Pete, can we have the Kermox? Can you just draw us some Kermox? Thank you.
What we're going to try to do is just get your bones back into alignment.
Harry's right leg is fractured in several places. To straighten it, the team will use traction and pull the leg back into position.
That's it, Harry. Nice big breath. And then just pull.
And then use the ankle as the thing that you're going to pull on.
Well done.
I don't think it will go back.
I don't think it is. It feels it.
How hard are you pulling?
Very.
But something's wrong.
Let me have a feel.
Have you got it?
Yeah, I've got it.
Yeah.
Dr. Neil takes over the traction.
You're doing amazing.
I'm happy.
All right, Harry, this should bring you some relief. It feels like something's not, it's caught on something.
So he's off-ended the end of his tibia into the complex upper reaches of the...
Just leave it as it is.
Despite the expertise of the team, Harry's fracture is so severe it will have to be dealt with in surgery.
You're doing really well, Harry.
What's the score then? What do you want us to do?
So we're drawing up some Cormoxiclav. Are you allergic to anything, Harry?
Got no allergies.
No allergies?
He is on morphine, as I said.
Oh, something pulling me leg, that's all.
But now down to destination.
The team are amazed by Harry's cheerfulness in the face of his injuries.
What we're doing now, we're giving him an IV injection of broad-spectrum antibiotic, which will hopefully stop any infection that you might get. Because obviously, if you break your leg, it's bad enough, but if you break your leg and then the bone gets exposed to the air and the dirt and certainly everything that's going in the car park, the amount of infection that can get in there can really hamper how they recover and how well the leg heals. So it's something that we try and give them within an hour of the injury, and it has a really sort of positive effect on the recovery.
Definitely be a story to tell him when you go through the airport.
He'll still be nattering to you, all right? But it's a nasty injury of his ankle.
I know. And
he's on warfarin, isn't he? So
He don't do things by half, to be fair.
he's going to cause you some trouble.
I know.
All right.
I'm not bothered.
So we're going to finish what we're doing, and then we're going to leave him with the ambulance crew to take him to the right hospital. Okay. Give him another 5 minutes or so, and you can come and say hello.
You may, as you find with...
I've already had 2 rolls in an ambulance.
Oh, flipping heck. What?
Broke this ankle.
Oh, flipping heck. You're not safe to let out, are you?
With plenty of painkillers, Harry is still cracking jokes, but the medics know he's not out of the woods. His long-standing lung condition will complicate his surgery and recovery.
His ankle's a bit of a mess. He's going to go to Manchester Hospital. Okay. It's Stephen Hill is going. Yeah, it's a trauma unit, so I've everything they need there. Did you want to ride?
Yeah, you go with him.
I'm sure that'll be fine. He's a tough old thing anyway, isn't he? And he's a good he's great.
Harry's wife Dot will travel the 10 miles with him to Manchester. Helimed 99 is stood down.
Right, lovely to meet you, Harry. Shame about the circumstances.
Sorry, we couldn't have a ride in an air ambulance.
Oh, never mind. Take care.
For Harry and his family, what started as a simple trip to the shops has gone horribly wrong. He faces hours of surgery, and his recovery is by no means certain.
So you were cycling for a couple of hours, is that right? And then you started having this pain, is that right?
Yeah, it's just got tight in the chest.
Keen cyclist Paul Truman did suffer a heart attack while biking in Dalby Forest. It was his 4th attack in 5 years. He was in hospital for 4 days and has now stopped mountain biking.
Was this up here? That's broken as well. 2 steps, and we're going to just lay down on this stretcher.
After the crash in South Yorkshire, the driver of the Jaguar was charged with several driving offences. Dave and Ruth Taylor, who were trapped in the other car, are recovering well.
It was horrendous, and we were both lucky to come out of it. And the frightening thing is, it could have quite ended very differently, and our little lad could have had no parents. It could have been as serious as that.
Ruth broke several ribs, her sternum, and suffered nerve damage to her knee. She was off work for 6 weeks. Dave had 2 major operations and was on crutches for 5 months. He's now returned to work.
I'd got a broken right femur. Both bones in my right arm were broken. My left arm was broken. I had a broken sternum, broken rib, and I also had a blood clot during my second operation.
A year and a half later, Dave is doing well, but it's had a major effect on his life.
One of my goals was to play football with little lad or go on a bike ride, and that's something we've worked towards, and we're doing it reasonably regularly. So that was always a big target, a big push to try and get back to normality, for want of a different word, a different description. And hopefully we're there or thereabouts now.
Did he only hit his leg with the car?
Yeah, he just drove into his leg.
77-year-old Harry Bates underwent a 5-hour operation to plate and pin the nasty fractures in his legs. Sadly, he died shortly afterwards of acute respiratory failure. He had been married to his wife Dot for 53 years and left 2 daughters.